Hi, my name is Lori, and I'm a student pharmacist at Western U College of Pharmacy. Today we'll be talking about multiple sclerosis. MS is a chronic disease in which the body's immune system attacks the central nervous system. The insulated axons on the nerve cells in the brain and spinal cord become unmyelinated and lose their ability to quickly transmit signals. This causes a delay in the messages between the brain and the spinal cord to other parts of the body. The underlying nerve also gets damaged once the myelin sheath is depleted. When the signals traveling across the nerve fiber are not efficient, symptoms arise. Multiple sclerosis vary depending on the location of affected nerve fibers. Some symptoms may include numbness or weakness in one or more limbs, partial or complete loss of central vision, usually in one eye, often with pain during eye movement. Double vision or blurring of vision may also occur. Tingling or pain in parts of your body can occur. Electric shock sensations that occur with certain head movement. Tremor, slurred speech, fatigue, numbness, vertigo, dizziness, walking difficulty, balance and coordination problems, bladder and bowel dysfunction, and also sexual dysfunction may be felt. Multiple sclerosis has no cure. The effects and progress of MS vary in each person. Treatment usually focuses on strategies to treat MS attacks, manage symptoms, and reduce the progress of the disease. This includes drugs and physical therapy. Not treating this illness may cause progressive disability. T cells, which are immune cells, play an important role in the body's defenses. During MS, T cells gain entrance into the brain and recognize myelin as foreign and attack it. This causes the release of soluble factors called cytokines and interferons that start the inflammatory processes. Inflammation triggers other immune cells to further damage the myelin. Repeated attacks of the myelin lead to scar-like plaque built up around the damaged axons, decreasing the ability of remyelination. One strategy to treat MS attacks are using corticosteroids. Corticosteroids are mainly used to reduce the inflammation during a relapse. Examples include deltastone and solumedrol. They are similar in nature to natural hormones produced by the adrenal gland in the body. The primary action is to reduce swelling and the body's natural immune system response. It works by binding DNA in the cells of the body and regulating the expression of certain genes. This increases the body's production of certain proteins and enzymes that inhibit the action of inflammatory cells. They also decrease the permeability of blood vessels to prevent the migration of inflammatory cells to the site of injury. Strategies to slow progression of the disease include using beta interferons. These types of drugs, such as Avonex, Xtavia, and Rebif, bind to type 1 interferon receptors and activate tyrosine kinase, producing anti-proliferative and immunomodulatory effects. Unlike the first three, the mechanism of action for betaseron is unknown. Presumption includes induction and activation of suppressor T cell activity. Other drugs used to slow the progression of the disease include Copaxone, Gilenya, Tisabri, Mitoxantrone, and Aubagio. Copaxone. Doctors believe that these drugs work by blocking your immune system's attack on myelin. Gilenya. This works by trapping immune cells in lymph nodes. It may reduce attacks of MS and short-term disability. Tisabri. This is an antibody that binds to white blood cells and prevents their movement into inflamed organ tissue. Mitoxantrone. This suppresses the proliferation of T cells, B cells, and macrophages. It impairs antigen presentation and decreases the secretion of pro-inflammatory cytokines. Aubagio. This is an enzyme inhibitor. It is thought to reduce the number of activated lymphocytes in the brain, which reduces the lesions in people with MS. Other strategies are used to treat symptoms of MS. Ampyra. This medication may improve walking speed. It is a potassium channel blocker used to increase conduction of action potentials in demyelinated axons. Muscle relaxants can be used for uncontrollable muscle stiffness or spasms, particularly in the patient's legs. These include baclofen and tizanidine. Other medications may be prescribed for fatigue, depression, pain, bladder or bowel control problems that may be associated with multiple sclerosis.